Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. Many women will receive an epidural or spinal injection during their labor and then experience a headache afterwards. Today we will be talking about everything you need to know about spinal headaches and how to treat them. So click those like and subscribe buttons and stay with us. Spinal headaches are very uncommon. They occur within 1 to 100 women to 1 in 500 women who will develop this type of headache. And women in childbirth are more likely to get a spinal headache. Now, you may receive two different types of anesthesia: an epidural, which is where the needle and medication go into the space around the spinal cord, or a spinal, which is where the needle and medication go into the fluid around the spinal cord. If the epidural needle accidentally punctures the spinal membrane, which is called a dura, and that hole, if it's too big, some of the cerebral spinal fluid may leak out. When this happens and too much of it leaks out, this reduces pressure around the brain, which causes the headache. Symptoms of a spinal headache usually start from the day after you have the spinal to 1 week after the procedure. The headache is worse when you're sitting or standing up, but it actually gets better when you lie flat. You may also have neck pain, nausea, vomiting, hearing loss, dizziness, ringing in your ears, double vision, or you may not like bright lights. When we first realize that you have a spinal headache, we're going to try to do some very minimal interventions to help with that. And it starts with having you lie flat as much as possible. We may give you Tylenol or ibuprofen for the pain. And one of the things we really encourage is you drink plenty of fluids, especially fluids containing caffeine, like coffee, tea, or cola, because those can actually help a lot. The other thing we want you to do is to avoid heavy lifting or straining, and we hope that all of these interventions will get rid of your headache. Please remember to hit the like and subscribe button so you can get our latest content. The hole usually seals itself on its own. If it doesn't, then your brain is not cushioned as well due to the lack of the CSF, remember that cerebral spinal fluid. So if we leave this untreated, you're going to continue to be symptomatic. Also, additionally, there are rare potentials for bleeding, also called a subdural hematoma, or seizures. The way we treat this, if it's not sealing up, is a blood patch. A blood patch is where we take a little bit of your own blood out of your arm and we insert it into that dural space near the hole. Your blood will then clot and that seals the hole and stops the leak. Over time, the pressure increases around the brain and your headache improves. There are a few risks associated with a blood patch. For starters, you may get some localized bruising on the back at the site of the injection. You may also get backache or stiffness for a couple days. There is a small chance that we will accidentally puncture the dura space again. More rare complications include nerve damage, infection, and bleeding. If you have difficulty passing urine, severe pain, or loss of sensation in your legs or back, this is considered a medical emergency. There are other causes for a postpartum headache. For starters, if you get dehydrated, if you're not eating enough, if you're not sleeping enough, muscle tension can all cause headaches. The drop in your hormones postpartum can cause a headache, and even sinus infections. More serious causes of headaches can include high blood pressure, preeclampsia, blood clots, and bleeding. So if you have any of these, you need to call your healthcare provider immediately. Signs of a medical emergency that require you to go to the hospital include vomiting, loss of vision, severe pain, numbness, high heart rate, also called tachycardia, or a thunderclap headache, which is severe and comes on suddenly with nausea and vomiting. I hope this video has helped you learn everything you wanted to know about spinal headaches. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those into the description below. Thank you so much for joining us at the Maternity Mentor.